welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's top headlines. Doctors question huge application fee for NEET PG examination. Referring to the lack of basic facilities during the recently held NEET PG examination 2022, doctors have started questioning why the National Board Examinations is charging so much of money for organizing an online entrance test. While NB is charging Rs 5,000 per general candidate for only appearing in the examination, the president of the FAIMA Doctor Association, Dr. Rohan Krishnan, has pointed out that on the other hand, NEET PG 2022 aspirants were complaining that the examination centers lacked the basic facilities such as availability of water, air conditioning, etc. Union Minister of Health and Family Welfare Dr. Mansukh Mandaviya addresses 75th session of World Health Assembly WHO. The Union Minister of Health and Family Welfare and Chemicals and Fertilizers Dr. Mansukh Mandaviya exhorted India's commitment to build a more resilient global health security architecture. Underscoring the need to strengthen WHO, the Union Minister noted that, as highlighted by India's Prime Minister, there is need to build a resilient global supply chain to enable equitable access to vaccines and medicines, streamline WHO's approval process for vaccines and therapeutics, and strengthen WHO to build a more resilient global health security architecture. As a responsible member of the global community, India is ready to play a key role in these efforts, he added. WHO says no evidence monkeypox virus has mutated. The World Health Organization does not have evidence that the monkeypox virus has mutated, a senior executive at the UN agency said on Monday, noting the infectious disease that has been endemic in West and Central Africa has tended not to change. Rosamond Lewis, head of the smallpox secretariat that is part of the WHO emergencies program, told a briefing that mutations tended to be typically lower with this virus, although genome sequencing of cases will help inform understanding of the current outbreak. Health experts watch for concerning mutations that could make a virus more easily transmissible or severe. An aspirin a day is not good for heart health. It can lead to internal bleeding, according to experts. Millions of elderlies take aspirin daily and not always because of a doctor's recommendation. For 3 decades, the U.S. Preventive Services Task Force, an independent and influential panel of experts, have been reviewing the growing evidence of aspirin use for preventing first heart attacks and strokes. Last month, it issued its latest recommendation on aspirin use, that the first in 6 years. The panel warned adults older than 60 against starting an aspirin regimen for primary prevention. Dr. John Wong, a task force member, said that it carries possible serious harms, notably an increased risk of internal bleeding, and those harms are higher than we thought in 2016. People taking aspirin for secondary prevention because they have already had a heart attack, stroke, or intervention such as stenting or bypass surgery face higher risk of subsequent cardiovascular events, and aspirin might remain part of their treatment. For adults who are aged between 40 to 59, the net benefit of taking aspirin daily would be small, the task force concluded. They may choose to start a daily aspirin regimen if, based on widely used health calculators, they face a 10% or higher risk for cardiovascular disease over the next decade, but that should be an individual decision. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.